Well, hello and welcome, everyone. I am Gustavo Tolosa, the webinar host for today, and very excited. I know you all are, and for me, it's always like the first time having Dr. Lisle here with us is such a privilege. And I know that there are always new viewers, so I always like to read a very short bio, although I should be reading like pages and pages about Dr. Lisle. We all admire him, and personally, I think he's just a very nice genius, because usually geniuses are not sometimes they're not nice, but this is a very nice genius. So Dr. Lisle received his undergraduate education from the University of California in San Diego, and with honors, and he completed his PhD in clinical psychology at the University of Virginia, where he was awarded the President's Fellowship and was a DuPont Scholar. He was then appointed lecturer in psychology at Stanford University and worked on the research staff at the Department of Veteran Affairs at the National Center for Post-Traumatic Stress Disorder in Palo Alto, California. His research and clinical interests have broadened to include health and wellness, self-esteem, relationship satisfaction, the treatment of anxiety disorders and depression, and optimizing achievement motivation. In addition to his work with his team dynamics, which I'm going to ask him either at the beginning or at the end to tell us a little bit more about this wonderful website, he is currently the staff psychologist at both the True North Health Center and the McDougall Wellness Program. Both are located in Santa Rosa, California. And also, he's a co-writer of one of the most amazing books that you all have to read now online, that we meet every Saturday. And I hope that we will be featuring this book in the future, and it's called The Pleasure Trap. So, Dr. Lisle, thank you very much for making the time for us today.
It's a great pleasure as always. Next time we'll skip that introduction. We'll get it down to one sentence.
No.
Great to be here, Gustavo.
Yeah, very good. Thank you. It's great to have you. So, Dr. Lisle, I have had many requests to do a follow-up webinar with you from our March 21st webinar, when we still didn't have a lot of the data, or maybe wasn't accurate or as accurate as we would have liked it at that point.
Right.
So part of this webinar is to talk a little bit about that, and also for our viewers here, since this is a live webinar, to ask questions. And I also have questions that people have emailed ahead of time. So let me read one of the questions. Hold on just a minute, and we'll put it here. I'm going to be looking down because I'm reading it. So someone sent an email saying, you said on March 21st that you were proud of the world for taking the measures that were taken, given the information we had at the time. You said that the evidence was starting to come in, and that it didn't look as bad as we feared, and that in retrospect, we would see that it would be a massive overreaction. Do you still think that way, or have you changed your mind in some way?
Oh, that's a great question. No, I'm glad. It's actually good to know what I said on March 21st. Yeah, I would say exactly the same thing. I would say that the world has feverishly been paying attention to each other with, obviously modern communications, so that we're not talking about newsprint coming by boat 3 weeks later. We're talking about people could find out what's going on in other countries So different governments can actually see what's happening inside other people's essentially living critical laboratories. And so in this way, the world's been trying to learn about this very fast. And I think we know a great deal now. There's still, when I say we, I would say that in a collective sense. In other words, what's known is a lot. What's known inside of the average head of the average individual on Earth is not very much. So the data and the evidence about what we're facing and what we have faced is now becoming clearer. I'm pretty amazed at how much the world mobilized, country by country, each with their own flavor, to try to figure out what it is that they were going to do. And people took a sort of a spectacular, high energy, very expensive process to try to curb this, with varying degrees of results, of which we're going to be learning about in the weeks and months to come as we go back and analyze the evidence. In terms of my prediction that this was a big overreaction, I think that's true. I think we now know so much more than we did then. Again, it doesn't reach the news media, apparently. You have to remember, the news media is full of perverse incentives. So the incentives are to have people terrified and to have them glued to their screens. Nothing glues people to screens like fear. And so the actual evidence about what's actually transpiring is extremely reassuring compared to what it is that we had thought we might be facing. What drove the behavior of governments was the estimation out of Imperial College in London that this looked like it was a possibility of a 1% fatality disease. If that were true, we would have been seeing a massive disaster. It turns out that we're not looking at anything even remotely close to that. So let me give you an example of what's actually happening. So what we now know has transpired is that this is a disease which is essentially going to double your risk of death at whatever moment of life that you're in. So if you're 13 years old, your risk of death in the next year is essentially zero. And your odds, the fact that corona exists in the world, basically 2 times 0 is 0. So we find out that in the United States, which there's about, 40 million human beings that are below the age of 15, we have had precisely 9 deaths attributed to where corona had a hand in it. 9 in 40 million. Okay, that's like less than getting hit by lightning. So where we're going to see, as we look at the evidence as we get older and older in the population, we're going to see if you're 50 years old, your odds of dying in the next year they're very low, but they're there. So a few people get cancer and die, a few people get heart attacks and die. If you have the coronavirus, if you get the coronavirus, that effectively doubles your rate of death. So it goes from extremely small to 2 times extremely small. Now you can imagine what's going to happen if you're 80 years old. So if you're 80 years old, statistically, the odds are that in the next year, there's a 10% chance that you will die. So that is what the stats are. If you're 83 years old, the odds are probably 11 or 12% chance that you're going to die. So starting at about age 80, you have about a 1 in 10 chance that you won't make it past 81. That's just the way it is. You're starting to reach the limits of the human lifespan. So you can see what's going to happen with coronavirus, that your odds of dying of coronavirus are, not surprisingly, 1 out of 10. In other words, so what's happening is effectively it's going to double your rate of likelihood of death. So there's a 10% chance that you were going to die of something, and then we're going to add 10% from corona. So with the coronavirus exists in the world, so an 80-year-old, instead of having a 10% chance of death, they have a 20 if they're infected. Okay. Now it doesn't quite work additively and independently that way. So The mathematical geniuses are trying to figure this out now in order to estimate the overall social cost of the virus. And it looks like a good guess is that probably 2/3 of the people that die of coronavirus would have died in the next 12 months. Okay, so that's an important way for us to look at coronavirus. And of course, it's going to also be the case that we're going to make that number bigger. It's probably going to push 80% if we go out to 2 years. So essentially, of everybody that's dying of coronavirus, so when in the United States it's now 80,000 people apparently. So of those 80,000 people, apparently about 55,000 of those people would have died in the next 12 months. The average length of their life without coronavirus would have been 6 months. Okay. So in other words, if you're going to die in the next year, you might die 12 months from now, you might die next week. The average would be 6 months. So the coronavirus is impacting 2/3 of all victims of coronavirus are having an average reduction of life expectancy of 6 months. That's important for us to understand when we're trying to essentially analyze what should the country and the world be doing in terms of mitigation action in order to reduce the tragedy. The question is, what is the tragedy? It's certainly a tragic thing for someone to lose 6 months of their life, but this is quite a bit different than someone dying in an auto accident at 40 who just lost 40 years. They didn't lose 6 months. Okay, it's in fact, that's a 80-to-1 difference in terms of its ultimate impact. So the vast majority of people, in other words, probably 80%, would have died in the next 2 years with an average loss of life of 1 year. So now we can sit back and actually look at an overall understanding of the total human biological cost of coronavirus. In principle, the average individual that gets coronavirus essentially loses a year of life. So that means that with 100,000 lives lost in the United States, probably this summer behind coronavirus, 100,000 life years will have been lost. Now, in an auto accident, you lose about 40 life years. So it would take 2,500 auto accidents, fatal auto accidents, to lose 100,000 life years. So essentially, the coronavirus's biological impact on the United States will be the equivalent of 2,500 fatal auto accidents. That's not nothing. We have about 25,000 of those fatal auto accidents a year. So this is the equivalent of a 10% increase in the fatality rate of auto accidents. That's not what it looks like when you hear the media blaring to you. When you hear the media blaring to you and you see huge numbers, it is a terrifying specter to try to figure out what you're looking at. Human beings are not designed to do statistics. They're not designed to do mathematics with symbolic logic. They're just not designed to do it. What they're designed to do is they're designed to live in little villages and listen to people's voices and the tone of those voices, and to listen to what is it they say, and to use their emotions and their communications as a guidepost to what is true. This is what I call computer checking. It's the same type of mechanism that goes on at a watering hole on the African savannah, where there's a bunch of animals around trying to get a drink of water, and they're all watching each other to find out when the birds start flying off and the kangaroos, I guess there's no kangaroos in Africa, when everything starts to scram, i.e. when the big predator comes. In other words, everybody's piggybacking and computer checking on each other's computers to try to figure out what's real, what's true, and what's dangerous. So we now live in a vast media echo chamber where the different media outlets are competing with each other to essentially make the news sound grim, terrifying, and to have us on the edge of our seats. You couldn't expect it to be otherwise. There would be no other rational way to run a news agency than to constantly have headlining, fearful, fear-inducing news. And that's what we have. And now it starts out, it's fair when it starts out because they were afraid, we were afraid, the scientists were afraid, and the politicians were afraid, and all of us were afraid. And it made sense that everybody's desperate to try to get their hands on the information. And we had to overreact. And so exactly as I said on apparently March 21st, I'm proud of the fact that the world was, paying attention to this, reacted to it, overreacted to it, didn't understand what they were dealing with, and did everything that we could figure out how to do to try to get a handle on it. Fortunately, now we're 6 weeks later, 7 weeks later, and as a result, we now know so much more. So we didn't wind up with anything close to a 1% fatality. It's some substantial fraction. It's maybe 0.2 or some estimates. It might be 0.3. It's nowhere near 1%. And also, more importantly than the fatality ratio is who are the victims. If the victims were more capricious and the average age of the victim was 50, then it would mean vastly greater amounts of life years lost to humans. Instead, now we see who the victims are, and we see, not all. There are 55-year-old victims, but remember, there are a few people that are 55 that won't make it to 56. And there's reasons they won't make it to 56 is because they're very compromised. And so some of those individuals, if they catch corona, they won't see 57 as a result of that. But those are rare cases. And so when we look at the record, we see that more people actually die incredibly. This is an incredible stat. I believe more people have died that are over 90 than are between 80 and 90. Now that's an amazing statistic. I may have that wrong. It could be that it's between 85 and 95, but I think it may be 90 plus. Okay. So more people die from 85 to 95 for sure than have died between 75 and 85. Now that's remarkable because there's an awful lot more people that are between 75 and 85 than are between 85 and 95. The reasons is that if you're 88 years old, your odds are not 10% that you will be dead in the next year. They're probably 25%. So if you catch corona, it goes from 25 to 50%. So in other words, we would expect that the older the people get, if you're 92, the odds that you are going to pass away in the next year are probably 33%. So if you get corona, it goes to 66. So you can see why all of the marbles are stacked on the elderly and ill. Okay, it's the weakest of your 80-year-olds that are in trouble. 90% of them would survive the virus and 10% of them won't. So now that we can sit back and actually look at the numbers and we can see the total biological cost, the total human cost of this, it's not nothing, but it doesn't remotely approach the catastrophe that was feared and it was responsible for driving the responses that the governments around the world have made to this. Now, the realities of this are not politically easy to sort of describe, and everyone wants to race to the front of the line and look like the humanitarian that cares equally about all people. It is not possible or wise to care equally about all people in an important sense when it comes to your efforts in public health, attention, etc. No one that runs a hospital cares equally about all people in the sense that if you're in trouble, you must triage and you have to figure out who you're going to save. And you have to basically direct your time and energy and efforts at the most effective way to get the biggest biological or biggest benefit that you possibly can. We now understand that we must be very fastidious and careful around nursing homes and adult living facilities, et cetera, where elderly people are. They need to be protected with as much technology and intelligence as we can figure out how to muster. However, for the rest of the world, it is not sensible and the payoff is absurd to keep people locked down and in fear the way they are. This will eventually become obvious It is not obvious yet. People still here in the middle of May, they're still living in the media echo chamber. And quite frankly, there's still enough uncertainty about some of the numbers that I'm talking about. And the numbers themselves need to be analyzed and thought through carefully about what it is that we're talking about. It's also true, and becoming evident, that it isn't necessarily useful that things like lockdowns even work, not if they're done in any kind of halfway measure. So somewhere along the line here, this is a very long answer to the question, Gustavo, but I'm going to just continue on for just another minute on this. Somewhere along the line in certainly the United States, we morphed our goals to some degree socially. We began with the scientists telling us, we began by having people say it's probably nothing. That was a mistake, okay? Then we had people say, oh my God, it could be unbelievably bad. That wasn't a mistake. That was a legitimate, honest warning that says we better take this seriously. The next thing was, you know what, if we're about to be hit by a pandemic, then we better not overwhelm our hospital systems. So we need to do what's called flatten the curve, which is to reduce the speed of the spread of a virus so it is that we don't overwhelm our health systems. That was totally intelligent as far as I was concerned. I see no possible argument with such a strategy. But somewhere along the line, Gustavo, it morphed, okay? And it morphed into, well, aren't we locking down so that we can just choke out the virus and have it be gone? That's kind of what it morphed into. And folks, that was never a realistic possibility. That doesn't make any sense. If you have an isolated population and you can shut down all the borders of your country, and you could control people's behavior in draconian fashion, you might be able to pull that off in certain places in the world. But you would never pull that off in a free society like the United States or the UK or anything like that. There's just no way that's going to happen. You're not going to basically have people welded into their apartments. That's not going to happen. So as a result, the virus is going to go through a viral process. The only question is, how does it go through? Does it go through quickly and overwhelm a health system? Or does it go through more slowly so that everybody that you can help can be helped? And that we don't displace health resources away from other people, from other disease processes that could use them. That was the logic. That logic is impeccable as far as I'm concerned. It, however, psychologically morphed into, well, let's just all stay locked down until it's gone. I understand. I understand why people would think so, but that isn't going to happen, wasn't going to happen, and will not be the future of COVID-19. This is going to be a virus that's going to be around for a while, and there will be flare-ups of it. We don't know how big and how bad they'll be. We'll know that it's going to be a lot less next year than it is this year because a lot of people have been exposed and there will be some degree of immunity. We also know that we know so much more about that we have to focus. We know who the victims are. So there will have to be tremendous focus on nursing facilities, for elderly, et cetera. So we got to be much smarter about that so that our fatality rates will drop dramatically as a result of much better management of that problem. But no, we are not going to choke this to nothing. That never was the goal. It became the semi-vague, muddy goal in the heads of millions of people and is the sort of vague goal that remains out there, but it simply doesn't make any sense. So this epidemic will wash its way through the populations that it inhabits. In the United States, it's now on the wane. There'll be other places where it's waxing for a while, and then it will go through its process and it will wane. And then we will sit back and learn everything that we can about how to mitigate its effects the way we do with the flu. And we'll go at it again when it arises again. And we'll try to be smarter and reduce the overall human cost. So I hope that this is a comprehensive sort of answer to a very, very good question. And I would say the same thing that I said then, that now it's very clear that the total biological cost is nothing like we were trying to prepare for. It's going to turn out that the economic costs are going to be huge because what I consider to be now a current and future massive overreaction. I think all the efforts are being put in the wrong place in this vague notion of choking it out, which you're not going to do. And instead of where they need to be, which is on super high vigilance around our elderly population, our elderly and ill population specifically. So this is the story. Humanity is using its ingenuity and its intelligence, and unfortunately also there is some other perverse incentives that will keep this from being managed optimally, and it will be much more expensive than it needs to be. However, in the end, when we look back over our shoulders 6 months or a year from now, our anxiety is going to be vastly reduced. And I actually believe that the anxiety in the US will be vastly reduced in 60 days. We will find out that the process goes through its curve, it goes through its infection cycle, and even though it will continue on and there will still be headlines, the number of tragedies will be reduced dramatically as the epidemic system essentially winds down.
That was a very comprehensive answer. Very good. Thank you. Thank you so much. You as usual, just nailed. Dr. Lisle, when we talk
what else do we have?
Okay, when we talk about numbers and statistics, I know that it may sound cold to people who, someone here mentioned that she had lost 3 friends or 3 people that she knew. So it's not that we mean to just treat people as numbers, but I lost 2 people to heart attacks in these 3 months that I know, and they're so it touches us because it's people that we know. But what you're trying to give us is the big picture of the panic that we were going through.
Yeah, and sooner or later, human beings will get in touch with what the real risk factors are, and they will, and then the politics and the decision making can follow. Okay, politics and decision making really generally can't lead something like this. They have to follow because these people can't afford to lose their careers, or they don't want to, and so as a result, they have to be essentially following what the general tenor is of the humans in the society. And that general tenor of humans in the society is now being whipped into a very, an extended fear reaction, which is completely understandable. And so with this much media attention and this much catastrophizing, you can better believe that the average person has a great deal of anxiety. That will dissipate as people find out that they're not seeing completely mystifying tragedies left, right, and sideways. So the person that that lost 3 people, the 3 people they lost, probably it makes sense according to what it is that we understand about coronavirus. Okay, so it's unlikely that 3 healthy 55-year-olds were lost. That's undoubtedly not the case. So I know of one individual that lost their lives with coronavirus. That individual was in her 80s and ill. Okay, so that's all we have to do is stare at the numbers and the charts, and we see that this is true. That doesn't mean that there won't be people that might not lose 10 years of their life to corona. They might. Okay, they might, and that is a tragedy. But those level of tragedies are rare. And so as we begin to understand how rare those are, the fear will reduce considerably.
All right, thank you. I do want to mention that this webinar in the front page of the registration page said that it was going to be mostly about this topic. So just in case, because some people are wondering, but it did say it. Okay, so
fair then. Fair.
Dr. Lisle, someone is asking a question that I think is interesting. I'm wondering too, what is your view about mandatory COVID-19 vaccination?
Yeah, I don't think that makes any sense any more than mandatory flu vaccinations make any sense. So the we're going to understand that, as I said, the total cost of coronavirus in the United States is in its future will be relatively trivial compared to everything else. So compared to, for example, the influence on the health of the population relative to smoking, smoking will drown coronavirus by a factor of 100 to 1 or more in terms of its effect on people. So once again, this is a very good question born out of the intense scrutiny now that people have for this new threat as they listen to experts, and they have all kinds of fear about this, and they're hoping desperately that there's going to be this solution to end this threat. Whereas if I were to tell you that the magnitude of this threat would be, the loss would be massively more than made up for if people in the US reduce their smoking percentages from 14% down to 13%. That would be vastly more months of human life would be saved. So keep in mind that some massive program to go after very small potatoes ultimately is absurd. Now, whether or not it happens or not is kind of not relevant. In other words, it very well may happen because it may have great political force, but it doesn't have any legitimate practical argument. And so, we'll see what happens. You know, these. It turns out that just despite all kinds of controversy around immunization, I think immunizations are usually these days for an individual kind of an even bet. In other words, you get some benefit from being immunized, and you have some costs that are very small benefit, very small costs. In the end, I don't have strong feelings about immunization particularly. So I'm not too worried about what government makes what decision on that. I can live with it either way.
All right. Thank you. Thank you very much. Someone is asking if you could please provide, but I don't know if you can do it like this, or if you could send me an email, and I can provide it later, provide sources for all numbers referenced so we can review them as well. I don't know.
The number of the notion that 2/3 of people would have died in the next year. That's I think what's the guy's name? Neil Ferguson. That's the original architect, the head of the Imperial College London model that drove this worldwide response to the pandemic in the first place. So obviously, highly respected group of people. It's not just him on his own. So if you look under Imperial College estimations of whatever it is, I forget what numbers I was looking at, but that's where I got those numbers. That and additional mathematicians are working on the same problem. So you should be able to find those. If you were to Google something that said something callous like would they have died anyway, something like that, you will eventually find your way to that mathematics, and you'll see that this has been deeply considered and been figured. And I think that they've got some estimates that are pretty compelling.
All right, very good, thank you. So another question is, what would you suggest the basic precautions that we should take when we go out to a store or whatever? I mean, what is common sense, if there's such thing anymore?
Well, for me, it would be thinking, let's suppose that I heard that there was a major flu. Okay. So if I'm in the world in a major flu, then I'm wanting to stay away from anybody that looks like they're sniffling. Okay. And, which I do naturally. And I'm sort of a natural introvert, and introverts are inherently uncomfortable by being close to other people. And we actually believe the evolutionary reasons for that personality characteristic is a lower risk tolerance for infectious disease. That is actually a leading theory in the understanding of the evolution of introversion. So the notion of standing 6 feet away from people in line at a store, and this all comes pretty naturally to me. When I was a kid and I would go for lunch at high school, I wouldn't sit with the other kids at the cafeteria. I would get my lunch and I would go out to a park and sit under a tree by myself. That's how I spent my lunch hours as a high school student. So what would I think now? In other words, if I heard that there was a raging flu epidemic, then I would I would be less likely to be hanging out in restaurants, and I would be wanting tables that were further apart from other people, etc. In other words, all the sort of social distancing thing that we've now made everybody conscious of are things that I would have done naturally in the face of some kind of nasty flu virus. And I think that that's what most of us should be looking at this and analyzing it for what it is. If you have elderly people close to you, which I do, I have an 87-year-old mother, so I'm extra fastidious, as I would be probably thinking along those lines. In other words, if I started to feel sick, I would tell my mother, which I have in the last few years. I'm saying, hey, listen, I'm not going to come over and visit today. I'm feeling like I could be getting sick. So I was not even wanting to give her a cold, because a cold at 87 years old, could be serious trouble. And so that's how I would look at it. In other words, protect the people close to you that may be vulnerable. Protect yourself, just because not that you might be fear of your own death. I no longer fear coronavirus in the way that I might have feared it 6 weeks ago before we had the evidence. So now I don't fear it in terms of a life threat. I fear it in terms of I don't want to go through a nasty flu. And I don't want to spend 3 weeks of my life super uncomfortable and in trouble. I have a friend of mine right now with coronavirus, who incidentally had been very carefully isolating herself for the last month. Got it anyway. So I don't know how. Must have come in on a package outside of her front door. That's really the only way that could have happened. And anyway, so she has it, and she's had it for about 10 days, and it's uncomfortable and clammy, and she's got a fever, and she's in her 50s. So she's going through what we go through when we have a relatively, pretty unpleasant thing. So that's what I would say. The worldwide fascination with wearing masks, I think, is going to come to an end, probably relatively soon, as the data starts to come in and explaining that this isn't helping anything. So on we go with our adventure in coronavirus, and we will. But I'll go out and wear a mask if it's required for me to get into a store. I'll put my mask on. In other words, I'm not a civil rights patriot that wants to take on the world and put everybody with a sword. I don't care. I'll follow the rules, but I'm also realistic in looking at recent human fashionable behavior and fear, and I recognize that this is all going to come to an end pretty soon.
So one of the questions that people are asking is what you just mentioned about wearing a mask. I mean, what if we're required? Like, I cannot go to the supermarket without a mask because they will not let me in.
Right.
But if I'm walking out, if I'm in the backyard in the sun, I'm not going to be wearing a mask. So who are the people that you would say need to wear a mask? Or is it, how efficient is it? That's the main question going on here.
I don't think there's any evidence to support its use. Okay, so I think that this is a obviously somewhere, somehow, if someone is sniffling and sneezing and has coronavirus and they sneeze all over you, then yes, you would have been probably better off with a mask then, and you would have been better off had they had a mask then. So the statistical odds of that being the way that somehow this mask is going to protect you, I think, are really remote. And so and like I said, the scientists, many of the world's leading infectious disease scientists, are rolling their eyeballs and just shrugging their shoulders. Okay, so fair enough. If that's something, gives people something to do to give them some sense of control over this process, And if the governments and governors want to insist on this because it makes it look like they're doing something and quote doing everything we can, fair enough. But so I'll follow the rules, but the rules are going to change soon. And with the change of the rules, it's not going to increase or impact your risk levels. The risk levels of corona are what they're going to be. This thing has essentially a life of its own, and we'll learn as we go about what that life is going to look like. And we'll also learn how to treat it better, maybe. We may eventually wind up with a vaccine. We may or we may not wind up with a vaccine. We've had coronaviruses around forever. The common cold, we haven't got a vaccine yet. Okay, so this is a challenge for science, and they may pull something off. I think probably more likely than that is the likelihood that we will learn a little bit better ways of mitigating the effect, and so that we won't have quite so many of these compromised people having to pay this price. And so I think that's much more likely than we're going to fix it on a systemic basis by somehow immunizing or masking the world so that it gets stamped out. I don't think that's going to happen.
All right. Thank you. Fair enough. Dr. Lisle, another question or concern that many people have is the amount of misinformation out there. And we hear, because this statistic, and have you heard that this, and have you heard of that? And actually being right here in the chat, there's a lot of, and look at these numbers. Well, no, but look at these numbers. And so
yes.
How could we balance this so that we will not just lose our minds? Because it really is great. And part of it is what you were saying is connected to the media.
Yes.
And what could a person do to get some kind of balance? Just not watch any news. What should we do?
Yeah, I would say the following. A useful thing for me is I've gone to the CDC website, United States CDC, where they record the actual documented fatalities. And if you look at that, you'll see that at this point it's around 50,000. And we know that there are more coming because it takes a week or two for these to be tabulated and recorded at the CDC. But we will see that the process. And you'll also then be able to look up different tables that will tell you, for example, about the demographics of the victims. And so you can see, for example, you can see the age breakdown. So I have a friend of mine who is around 50. And so she just wanted to know, well, now you keep saying it's not that big a risk, but what's my situation? So I looked it up, and it turns out that in the United States, I think there's around 20 million women between the ages of 45 and 54. I think you could, if you look it up right on that table, it will tell you. I think that's about what it is. So of those 20 million, there have been about 490 COVID-related deaths. So that's 500 people out of 20 million. So if we start to do the math, that would be the same as 50 out of 2 million, or 5 out of 200,000, or 1 in 40,000. Okay, so your odds of dying in an auto accident this year are 1 in 5,000. So far through the majority of the COVID epidemic in the United States, if you're a 50-year-old woman, your odds are 1 in 40,000. So you are 8 times greater risk in your car than you are from COVID. That's important for you to realize and to calibrate. So it isn't that COVID is zero. It's just that you have to hope that if you're a 50-year-old lady, that you are one of the 39,999 out of 40,000 that doesn't die of COVID. Okay, that's a way to sort of put these things in perspective. So when you see these numbers, also I had a woman really worried about her children, very reasonable. She called me up and said, listen, my kids have asthma, and I'm worried about the COVID virus because of its respiratory impact. And I said, well, let's look it up. So we looked it up on the CDC website, and there are 9 fatalities of people 15 years of age and younger in the United States, which represents 40 or 50 million people. So it's 1 in 5 million. Okay, so this is it's useful sometimes. Some people get reassured by numbers. That's me. Other people are terrified by any number at all. So I have my friend Larry, who's a little bit obsessive compulsive, and if he sees, if he saw a number like 4 children, age under 10 out of 19 million, he would say, "Oh my God, that if I have a kid, that could be that 4. There's 4 right there." So he can't handle any risk that way. It bothers him. 4 out of 19 million, it all looks the same to him. So if you're just a person who any possibility is enough to ring your chimes, then I would say just try to stay out of the discussion altogether and just turn off the TV and just try to get away from this and listen to Mozart, because you're going to get shouted down in terms of your own anxiety about this. If you're someone who's more comfortable with numbers and can sort of picture and essentially get a feel for what this means, that if you understand that you have, for example, in your lifetime, a risk that you take in this lifetime is that we operate in vehicles. And so you have about a 1 in 60 chance of dying on the roads in the United States. That's an amazingly high statistic. It's been dropping for decades as the cars get safer, but it's there. And it's a risk that we all take. We go our whole lifetimes with this. Now, at my age, it's now less because I've lived through the riskiest part. So in the rest of my life, my odds are probably 1 in 200. But in 1 in 200, that still seems high. In any given year, it remains about 1 in 5,000. So, but remember, 1 in 5,000, at my age, my odds of corona are probably 1 in 10,000 and 1 in 15,000. That I would be a fatality of corona. So similarly, well, not quite similarly, with auto accidents. Auto accidents have a capriciousness that is terrifying. In other words, you're going through an intersection and somebody in a truck hits you. It's like it could take your whole life through no fault of your own, and you couldn't see it coming. Corona is not that. Okay, corona is, there are things that you can do. If you're very worried about corona, you're 66 years old and you are not in very good condition, etc., and you're worried about corona, don't be worried about corona, get healthy. Okay, so the vast majority of 66-year-olds that would ever come down with corona would survive it. If you wouldn't be one of the survivors, it's because you're way too close to the line with your health. So you can take charge of your risk in a way that you would take charge of your risk in a car, and yet better than that. In your car, you buy a big, strong car with good safety equipment. You don't drink and drive, and you try to stay off the roads as much as possible, and you always wear your seatbelt. Okay, so there's things that you can do to substantially mitigate your risk. You could probably do even better mitigation of your risk with corona if you eat healthfully, get yourself in better condition, essentially quit your cigarette smoking, which is a lot of the victims. In other words, if you do all the things to make sure that your cardiovascular and general health function are good and your immune system is strong, then you shouldn't be a victim of this. Okay, so that's what I would say about the message here, that you actually exercise tremendous control over this particular thing, and it is not as big a threat as a motor vehicle. That's a way to look at it.
Right. Well, that is very true, Dr. Lisle. Get healthy and reduce your chances. And maybe that's a topic for some other time. I do want to answer someone that was asking, yes, this webinar is recorded, and later on everybody will receive an email with the recording of it, and then you can share it. One last question, Dr. Lisle. There are many, but obviously we won't be able to get through them. But someone asked if, let's see, hold on just a minute. I would be interested to know why many it seems, are using this time of confinement to indulge themselves in the pleasure trap. Is it energy conservation at work, a more primal response when our survival is threatened, or our personality dynamics take over when routines are disrupted? What do you think?
Well, I think it's a great curiosity. I think that I'm not sure that actually anything of the kind is happening. In other words, we would. I mean, it's an interesting speculation. I've read about how, I don't know, cookie sales are going through the ceiling, but that's just because restaurant chocolate shakes are not being eaten. So I'm not sure that the net effect of coronavirus has been to reduce anybody's self-discipline with respect to their food choices. I don't know that that's true. You certainly can imagine that it will be the subjective inference of many people who will go that route. So in other words, there will be people that, for a variety of reasons, that if we were thinking about a beach vacation in March and we were getting our act together, and then by April we realized there'll be no beach vacation this year, so why do I have to worry about my waistline? Okay, so the amount and different angles from which this could impact your motivation are varied. We do know that almost anything, any change, shift in motivation around any way to make it either easier to get junk food or more socially acceptable to get junk food is going to result in more junk food. And the reason is that your essentially will to do a really good job with respect to your health around food choices is fighting every instinct that there is in human nature. All of the instincts in human nature essentially are direct, dead on located towards the pleasure trap. It's all about trying to get the most for the least. And so that means the most possible concentrated doctored up calories that you can get for the least amount of effort possible. So if you had a routine that was working for you, where you were kind of up the learning curve, and there's a particular place you went for lunch every day that had a big salad and it had a little burrito, and that's what you did in between your dividing up your workday, and now you can't go to that place and you're having to stay home and fix it yourself, and you're not up the learning curve and you don't want to do it, etc. Now, so what are you going to do? Eat something easy and junky instead. Okay, so essentially any possible disruptive process, excuse, or anything else is very likely to weight the error towards the pleasure trap. It isn't that it has to, it's just that it likely will, because that's where the instincts are going. Fighting the pleasure trap requires an active, high level of motivation. It requires a feedback system of feeling good physically, as well as self-esteem that comes from having done a really good job, that can spin its way into a beautiful achievement cycle that sometimes people are able to sustain for very long periods of time. What we typically find is that when some shift happens in their life to disrupt it, a new relationship, new job, new location, etc., then typically then they get into trouble, just because that amount of, it's not easy to sustain an excellent pattern of behavior in the face of the pleasure trap, which is constantly nagging at you to go that direction. That's because it's human instinct, and the biggest problem in human nature was caloric deficiency for survival. And the pleasure trap is a massive trap, basically saying eat the richest thing and you will be safe. So that's what I think that probably is. So I think that the person's observation or intuition about something happening is accurate. But I think those are some of the more nuanced explanations for why it's going to be probably typically more difficult now than it might have been if you had been in a beautiful group before.
Dr. Lisle, to finish today, this may be too much to ask because I don't know, but we've been talking about, you have been mentioning the pleasure trap. Would it be too much to ask to tell people in a nutshell what the pleasure trap is? I mean, I know this is a topic that takes hours to develop and talk and explain. Could you just give us?
Sure, I'll give you an example of the pleasure trap. I have cats, and I have cat food that is healthy for them, which is leaner, which would keep them leaner. And that's what they eat. And then I have treats that I give them because I know that they love these things that are richer. I think they're greasier and they have like salmon in them or whatever it is. And they go crazy over these things. And if they had their way, that's all they'd eat is the treats. Okay. And that's because that's their instinct is to eat the richest food in their environment. And so this is the pleasure trap is the notion of when we make something more intense and richer than it was designed to be, it becomes unbelievably compelling. It traps the motivational system. The ultimate example of this would be big time drug addiction. Like think of heroin addiction, that essentially the pleasure rush from an opiate is unnaturally intense. And what the feeling is very similar to orgasm. In other words, when you have an orgasm, that's an endorphin storm inside the brain. And the use of a big opiate has a very similar effect on the nervous system, is that relaxed euphoria. And so you can imagine that if you could get that relaxed euphoria in 10 times the concentration that could happen naturally through an orgasm, you could see how unbelievably compelling that would be, how incredibly addictive and unbelievably dangerous. Okay, that is the story of the pleasure trap. The story of the pleasure trap is the story of what we call supernormal stimulation. And when we discuss the pleasure trap here and in my career, we're mostly talking about food. So the modern food supply is a supernormal stimulation. It is not normal. So a cheese pizza with pepperoni on it, that is not a natural food for human. There's no pepperoni pizza trees anywhere in nature. You'll never find one. Okay. And so the fact that is effectively like miniature heroin. It isn't as destructive. It doesn't completely derail people's lives, but it just nags you into a corner where you're doing something that is too rich. The fuel's too rich for the system, and it eventually causes problems. And the major resultant influence is obesity and cardiovascular disease. So these are, the pleasure trap is the story of how it is that we get lulled into doing something that feels really right, but in this case is actually counterproductive. So that's the story of the pleasure trap, and the pleasure trap's always out there. It's never going away. All we can do is know that it's there and to try to organize our lives against it as much as possible to stay out of it as much as we can.
Correct. Well, thank you so much. I want to remind people that your website is called Steam Dynamics, and you will get a link to it in the email that will go out. And right there's a button that allows you to get an online, what do you call it?
Consult.
Yeah. Thank you. With Dr. Lisle, and so you can do that, and I highly recommend it. Thank you, Dr. Lisle, for this very positive, message that is hard to find when we open the newspaper or watch the TV or talk to people. Thank you.
Yeah, it's we're getting through it.
We will. We'll get through this. Thank you.
Very good, Gustavo. Thank you for having me.
Goodbye, everybody, and thank you, Dr. Lisle. Bye-bye.